Most men think aging only steals their strength or memory, but it doesn't stop there. Your penis, as much as your heart or brain, can wither when neglected, taking away not just function, but your confidence, your dignity, and the connection you cherish most. I'm Dr. James, urologist and professor of men's health, with over 30 years guiding older men back to feeling like themselves. Today I'm going to share 5 science-backed ways to care for your penis every day, no medications required, plus a bonus tip at the end that most doctors never mention, but could spare you from one of the most painful conditions we see. Stick with me and you'll discover how small daily habits can transform your health, your self-respect, and your relationships for years to come. Here's how today's video breaks down 5 essential care steps you can start right now, plus a bonus habit at the end that might surprise you. First, we'll talk about keeping your penis active, because use really is the best prevention of decline. Next, we'll cover proper hygiene techniques tailored for changing skin and sensitivity as you age. Then I'll show you how to protect yourself during intimacy by avoiding a hidden risk that most men never hear about. After that, we'll dig into the surprising impact of too much pornography and how dialing back can revive real connection. Finally, we'll explore lifestyle pillars, nutrition, exercise, sleep that form the foundation for lasting vascular health. And don't go anywhere, because our bonus tip about what to wear or not wear at night could be a game changer. If you're ready to reclaim control, type 1 in the comments now. If you've got questions or want me to clarify anything as we go, type 0. That feedback shapes the rest of this channel and helps me serve you better. And before we dive in, make sure to subscribe and click the bell so you never miss the practical, age-specific advice I share each week. Let's dive into step 1. Stay sexually active, use it or lose it. Many men assume that after 60, sex naturally fades into the background, like an old car parked in a garage slowly gathering dust. That belief itself becomes a self-fulfilling prophecy. Here's the truth. Your penis is no different from any other muscle or organ in your body. It thrives on blood flow, movement, and regular use. When it sits idle, circulation decreases, elasticity weakens, and tissues begin to atrophy. Doctors call this penile disuse atrophy, and it's far more common than you might think. Think of your penis as a sponge. When you squeeze and release it, fresh oxygen-rich blood flushes in, keeping the tissues nourished and resilient. Skip that routine squeeze, whether through intimacy, masturbation, or medically approved devices, and the sponge gradually loses its spring. Blood vessels narrow, endothelial cells become sluggish, and the cells that line your penile tissue start to harden. Over time, that stiffness not only hinders performance, but can lead to painful conditions and emotional distress. But here's the good news. It's completely preventable. Even gentle, regular stimulation sends a powerful message to your body. This tissue matters. Vacuum erection devices, often thought of as a last resort medical gadget, can be an excellent adjunct when intercourse isn't possible. By creating suction, they mimic the pressure of a natural erection, encouraging blood to flow and stave off atrophy. Pelvic floor exercises, simple contractions, and releases of the muscles you use to stop urination further support circulation and can even improve both firmness and control. Beyond the physical mechanics, staying sexually active carries a psychological boost that ripples through every aspect of your life. Confidence soars when you know you can maintain function. Anxiety about performance fades. Intimacy with your partner deepens. I've seen men in their 70s rediscover a spark they thought was lost forever simply by committing to daily rituals that keep the blood flowing. And that renewed confidence often spills over into better exercise habits, improved sleep patterns, and a stronger sense of self-worth. If intercourse isn't currently on the table, don't see that as an endpoint. Solo stimulation is just as valid, from gentle manual stimulation to partner-approved devices. It all counts toward preserving tissue health. The key is consistency. A few minutes each day can make the difference between a healthy erectile response and a slippery slope toward dysfunction. Remember, this isn't about recapturing the vigor of your 20s, it's about nurturing the strength you have now into your 60s, 70s, and beyond. Your body responds to use at any age. By choosing to stay active, you send a clear signal to every cell, I still care. And in response, your physiology will reward you with improved blood flow, enhanced tissue elasticity, and the peace of mind that comes from knowing you're in control. Next, we'll explore how proper hygiene serves as the foundation for every aspect of penile health. Master proper hygiene. Proper penile hygiene isn't just about cleanliness, it's a cornerstone of health that most men neglect once they hit their 60s. As we age, our skin thins, becomes drier and more sensitive. The immune system slows, making it harder to fight off infections and heal irritations. What might have been good enough in your 40s can leave you vulnerable today. First, understand that bacteria, sweat, and dead skin cells accumulate naturally, especially under the foreskin, if you're uncircumcised. Left unchecked, this environment can lead to balanitis, painful irritation, or even increase your risk for serious conditions like penile cancer. Countries with high rates of penile cancer almost always cite poor hygiene as the primary culprit. So what does proper cleaning look like? Begin every morning with warm water and a mild, unscented soap, nothing harsh or perfumed. If you're uncircumcised, gently retract the foreskin, rinse all areas underneath, and use your fingertips to loosen any residue. Rinse thoroughly. For circumcised men, focus on the entire shaft and the areas where skin folds naturally occur. Always pat dry, never rub, so you don't irritate fragile tissue. Moisture left behind becomes a breeding ground for bacteria. After any sexual activity, make this routine non-negotiable. Vaginal fluids, lubricants, and natural oils can disrupt the balance of healthy bacteria on your skin. A quick rinse post-intimacy prevents lingering irritants that lead to odor discomfort or inflammation. Beyond the mechanics, think of hygiene as self-respect. When you care for this part of your body as diligently as you brush your teeth or wash your face, you reinforce a positive mindset about aging and vitality. You'll notice small shifts, greater confidence, less anxiety about odors or discomfort, and a renewed sense of dignity. I've seen patients enter my clinic embarrassed by persistent redness or itching conditions easily resolved by a simple upgrade in their cleaning routine. Within weeks, the irritation subsides, confidence returns, and they carry themselves with an invisible lightness in the way they walk and interact. Remember, hygiene isn't a one-time fix. It's a daily commitment that pays dividends in comfort, health, and peace of mind. Now that you've mastered cleanliness, the next step is learning how to protect yourself during intimacy by avoiding a hidden risk almost no one warns you about. Protect during intimacy. Avoid semi-erect risks. Many men underestimate the dangers of rushing into intercourse before they're fully erect. It might feel like a minor detail when passion takes over, but forcing penetration with a semi-rigid penis can cause tiny internal injuries, micro-traumas that build up over time. These unseen tears in the spongy tissue and blood vessels set the stage for painful scarring known as Peyronie's disease, which can lead to curvature, discomfort, and even loss of function. Here's what happens. A fully erect penis has the structure and rigidity needed to withstand pressure. But when you push through before you're there, the tissue bends, strains, and sustains minute damage. Because these micro-tears often go unnoticed in the moment they heal by laying down collagen in a patchwork fashion scar tissue that's less elastic and more rigid than healthy tissue. Over months or years, that scar tissue contracts, pulling the shaft into a curve and making erections painful, or in severe cases, making intercourse difficult or impossible. Preventing this starts with patience. Wait until you have a rock-solid erection before any attempt at penetration. Use adequate lubrication, whether water-based gels or medically approved options, to reduce friction. Extended foreplay or gentle stimulation can help you and your partner get there naturally. If you're relying on medications or devices to achieve an erection, let them work fully before proceeding. Take those extra moments; they can save you from years of discomfort. Communication is key. Speak openly with your partner about needing time to warm up. Share that a slightly longer build-up means safer, more enjoyable intimacy for both of you. And remember, it's not about fragility, it's about informed care. When you prioritize readiness over rush, you protect your tissue health, preserve your performance, and sustain confidence. I've treated older men who thought Peyronie's disease just happens or isn't a big deal, only to realize too late that avoiding rushed intercourse could have prevented their condition. By simply slowing down and respecting your body's signals, you maintain the integrity of the tissue and keep intimacy pain-free. Now that you understand how to safeguard your body during intimacy, let's turn our attention to the mind, specifically the powerful yet often overlooked impact of pornography on your sexual health and real-life connection. Limit porn, reclaim real connection. In an age of endless digital access, pornography has become a silent epidemic, especially for older men seeking a spark of desire. What starts as harmless relief can gradually rewire the brain's reward system, conditioning you to expect fast, visually driven stimulation rather than genuine emotional intimacy. Over time, that conditioning can dull real-life arousal, leaving you frustrated in the bedroom, even though your body is physically capable. Here's the science: repeated exposure to high-speed novel sexual images floods your brain with dopamine. Your neural pathways adapt, requiring ever greater stimulation to achieve the same level of excitement. Real-life scenarios, slower, more nuanced, and often with complex emotions, struggle to compete. The result is what experts call desensitization. You have desire, but your body doesn't respond the way it used to with a partner. That disconnect can trigger anxiety and shame, fueling a cycle of retreating back to porn for quick gratification. But it's not just about performance. Excessive porn use can erode self-worth. When private rituals become your primary source of pleasure, you risk isolating yourself further, doubting your own appeal, and distancing emotional intimacy. You may find yourself hiding habits, carrying guilt, or feeling incapable of forming meaningful connections. That emotional weight adds stress, which in turn negatively affects circulation and erectile function, another hidden link between mind and body. The path back to authentic arousal begins with moderation and intentional practice. Start by setting clear boundaries, designate specific times, or limit total use each week. Track your progress in a simple journal. Note how you feel before and after, both physically and mentally. Replace some sessions with visualization exercises, recall positive memories of intimacy, or imagine a loving encounter with your partner. These mental rehearsals can retrain neural pathways to respond to emotional context rather than pixel-perfected scenes. Engaging with your partner directly creates the ultimate antidote. Open conversations about desires, fantasies, and boundaries foster trust, build anticipation, and deepen emotional connection. Experiment with shared experiences like reading erotic passages together or exploring non-visual forms of stimulation, touch, sound, scent, to broaden your arousal palette. Remember, this isn't about demonizing porn, it's about reclaiming balance. A little can be harmless, but habits that spiral into solitary high-frequency consumption can undercut real-life pleasure. By consciously limiting exposure and investing energy into meaningful connection, you revive your natural arousal system, boost confidence, and reinforce the brain-body loop that sustains intimacy. Now that you've taken charge of your mind's wiring, let's tackle one of the most powerful levers for penile health: lifestyle. Up next, we'll explore how everyday choices from diet to exercise fuel the vascular foundation for lasting performance. Lifestyle foundations for vascular health. Erections are at their core a vascular event. They rely on robust blood flow, healthy vessels, and balanced hormones, and those factors hinge on your daily habits. Think of your body as an engine. It runs best on high-quality fuel, regular maintenance, and consistent use. Neglect any of those and performance suffers. First, let's talk about smoking. Every cigarette damages the delicate lining of your blood vessels, causing inflammation and narrowing the pathways that carry blood to your penis. Research shows that men who quit smoking see measurable improvements in circulation within weeks, meaning firmer, more reliable erections without adding a single pill. Next, alcohol. A glass of wine may relax you, but excessive drinking disrupts hormonal balance and leads to dehydration, both of which impair blood volume and vessel flexibility. If you're serious about sexual health, consider cutting back to moderate levels, no more than 1 drink a day, and replace after-dinner scotch with water or herbal tea. Nutrition is equally critical. Foods rich in antioxidants and nitrates like berries, leafy greens, beets, and fatty fish support endothelial function, keeping your arteries supple and responsive. On the flip side, high-sugar, high-saturated fat diets promote plaque buildup, restricting blood flow over time. Aim for a diet that resembles the Mediterranean pattern: colorful vegetables, whole grains, lean proteins, and healthy fats from nuts and olive oil. Don't underestimate the power of movement. Just 30 minutes of brisk walking 5 days a week increases nitric oxide production, the molecule that signals vessel dilation. Regular exercise lowers blood pressure, improves lipid profiles, and boosts insulin sensitivity, all factors that translate directly into better penile blood flow. If walking isn't your cup of tea, try cycling, swimming, or resistance training. The key is consistency and progressive overload. Sleep ties it all together. Poor sleep disrupts testosterone production and increases stress hormones like cortisol, which constrict blood vessels. Aim for 7 to 8 hours of uninterrupted rest by establishing a nightly routine: dim lights, an hour before bed, limit screens, and maintain a cool, dark environment. Stress management matters too. Chronic stress floods your system with adrenaline, constricting vessels and diverting blood away from non-essential areas. Techniques like deep breathing exercises, meditation, or even a hobby you love can lower baseline stress levels and over time improve vascular health. The beauty of lifestyle changes is their ripple effect. When you start walking regularly, you sleep better. When you sleep better, you crave healthier foods. As those habits compound, your vascular system becomes more efficient and erections follow suit. You'll notice increased stamina, firmer responses, and a revitalized sense of control over your body. Remember, there's no reset button for lifestyle, you build it day by day. But each healthy choice sends a clear signal to your body: I care. And in response, your physiology responds with improved blood flow, balanced hormones, and a renewed capacity for intimacy. Your secret weapon for circulation and vitality. Even the best habits can leave gaps, and that's where Nitric Boost can step in. You've learned how diet, exercise, and avoidance of toxins build a strong vascular foundation, but sometimes your body still needs an extra push to optimize blood flow at the microscopic level. Nitric Boost is formulated to enhance your natural nitric oxide production, the very molecule that signals your blood vessels to relax and widen. Here's how it works as you age. The cells lining your arteries, called endothelial cells, lose efficiency in producing nitric oxide. This decline can blunt the dilation response, limiting the peak blood flow you need for firm, reliable erections. Nitric Boost combines clinically studied ingredients like L-citrulline beetroot extract and antioxidants to support endothelial health. L-citrulline converts to L-arginine in your kidneys, which directly fuels nitric oxide synthesis. Beetroot's natural nitrates enter a parallel pathway, further elevating nitric oxide levels. Meanwhile, antioxidants protect these delicate pathways from oxidative stress, ensuring that every molecule of nitric oxide you produce can do its job without being neutralized. Integrating Nitric Boost into your routine is simple. Mix 1 scoop in water or your favorite beverage, ideally after a workout or with a meal rich in healthy fats, to enhance absorption, and drink daily. Because it works synergistically with your body's own processes, you'll notice gradual improvements easier. Morning erections, increased firmness during stimulation, and faster recovery between sessions. This isn't a quick-fix stimulant. It's a foundational supplement that amplifies everything you're already doing in your lifestyle plan. Consider John, a 68-year-old retired teacher. He'd adopted a Mediterranean diet, walked 5 miles each morning, and cut out cigarettes 3 months ago. Yet, he still struggled with inconsistent firmness and occasional performance anxiety. After adding Nitric Boost, he reported firmer responses during solo sessions within 2 weeks and regained confidence to initiate intimacy more often. His partner noticed the difference too, leading to deeper emotional connection and less stress around sexual expectations. Of course, any supplement should be one part of a holistic approach you've already mastered: activity, hygiene, safe intimacy, mind balance, and lifestyle pillars. Nitric Boost simply fills in the microscopic gaps, ensuring that the blood pumped by your heart actually reaches and nourishes the tissue you care about most. If you're curious whether a daily scoop of Nitric Boost could complement your routine, talk it over with your healthcare provider. Together, you can confirm it fits your personal health profile and integrate it seamlessly with any existing supplements or medications. With that extra edge in circulation, you'll be primed for our final bonus habit, an unexpected nighttime adjustment that protects your tissue while you sleep. Stay tuned. Bonus tip: sleep without restrictive underwear. One habit few men consider: what you wear or don't wear to bed can directly impact tissue health. During sleep, your body cycles through spontaneous erections that oxygenate and maintain penile tissue. Tight underwear or snug sleepwear can compress your penis during these nocturnal events, leading to micro-traumas and reduced blood flow over time. By choosing loose-fitting boxers or no underwear at all, you give your body the freedom to perform its natural repairs without restriction. You'll wake up feeling fresher, preserve tissue elasticity, and protect against the subtle scarring that can lead to curvature issues down the line. Conclusion. You've now learned 5 essential daily cares keeping your penis active: mastering hygiene, protecting during intimacy, balancing mind and connection, and building lifestyle foundations, plus the targeted boost of Nitric Boost and the simple sleep adjustment. Each step reinforces your dignity, your health, and your ability to connect deeply with yourself and others. This isn't about chasing youth. It's about respecting the body you have and maximizing its potential at every age. If these insights spoke to you, give this video a like and share it with a friend, brother, or father who deserves to know this too. Don't forget to subscribe and click the bell. More practical, science-backed advice for men over 60 is on the way. You've taken the first step toward reclaiming your sexual health and confidence. Let's keep going together.